All right. JaCarie, Coach JaCarie, thank you for being willing to talk about some of the work you do with early childhood and things with EMDR. So if you could, please share a little bit about what you do.
Absolutely. So I actually work more in an attachment focused lens, so relational focused, and I work across the lifespan. I also think adults are big kids, and so a lot of the stuff that I implement with the kiddos, I also implement with adults as well. And so some special considerations that you need to think of when you're working with kiddos is one, behavior and play is their first language. And so a lot of stuff that you've learned in the training is going to be a little bit different with kids because you're going to try to figure it out through play or through behavior. Um, the one thing I tell people all the time is like, you need to be able to create distance. You can't just sit here and talk to them. And so you're going to have to do different things such as like maybe some sand tray, maybe some art, maybe some different, so to give you guys some examples, like when I go through the different phases, when I am doing like history story, I may do like a board game of life, and that might be the target sequence plan, right? A lot of the targets are still coming and you're still getting them. It's just in a different form. The kid can't sit down and talk to you about it, but we can do it in the form of play. We do therapeutic storytelling where I'm not talking about the kiddo per se, but I'm talking about Spider-Man, but you're still getting the same message and the same story across, and that is part of phase 3. One thing I want you to be really mindful of is that their cognition list is actually more simplistic. And so you would need to have a child cognition list. And that is more so like, I'm good, I'm bad, I'm smart, I'm dumb. It's really more simplistic than what you may have seen in your book. So just being mindful of that. I actually got some things, I actually brought some things around me to show you guys different ways that I actually implement bilateral with the kiddos. And that makes it more fun. That makes it more easy to like kind of slip it in with kiddos while you're kind of doing regular play. So you're integrating into what you're already doing. So I want to show you guys a couple of them because I'm fun, or I think I'm fun
I
anyway.
love this stuff.
Uh,
Sorry.
so here is my puppet.
Oh,
And so with the puppet is the eye movements. And so I usually am telling a story, and the story is about the kiddo. And I'm just moving the kiddo back and forth, just like you would do regular puppets, but their eyes are actually going to follow that. And so I usually use that with them to just help with some slow bilateral or fast bilateral, just depends. Um, Another one is stress balls. So I would have 2 different stress balls, and that bilateral for them will be very simple. They are having this dual attention, so they are distracted with the stress balls, but the left to right is the bilateral simulation. One of my favorites, but I couldn't find it, is my slinky. And so I also do slinky left to right with bilateral.
that's a good
Um,
one.
I've also have a sword, and I knight some of my kiddos left to right on their shoulders if we are implementing something positive for them. Um, let's see. This is a new one that I've tried and it actually works, and so I think it's pretty cool. I have these Bluetooth speakers that light up,
Yeah.
and when I turn on bilateral music for them, it actually lights up left to right. So not only is the music left to right, but the lights also go left to right with them. And so these are simplistic ways to be able to integrate that left to right with kiddos, and not have to like have them sit there. They're not going to be able to do that. They're not going to be able to sit there and stare at you and go inside. There has to be some sort of dual attention for them. Just a couple of other things that I do. I think for kiddos, sometimes numbers are hard and you're going to have to show an illustration for them. And so here's one of my favorites as well, is I actually use a fan. So how big is it? How small is it? And they can just show me. And the way that we check in is just how small or big the fan is getting. And that shows me whether or not it's going down or they're getting less distress or things of that nature. Another way is I use these toilet paper, and they can tear off how big it is. And then as I check in with them, what do you notice? How big is it? How small is it? They just keep going in and ripping off how big and small it is then. And that's how they show levels of distress, or right, level of distress and or volts. Another concrete way that I integrate container is a mason jar. And that is a concrete way of saying, you leave that here with me and we'll pull it out when you're ready to deal with it. And they have full control over what they can put out. And the message is, it stays here with me. They don't have to take it with them. And
Mhm.
so I want to point some of those things out as different ways that I integrate bilateral or things to just be mindful. Again, especially with the child cognition list, it's a little bit more simplistic. So you want to get a child cognition list and move through it that way. Um,
And
I
then
think that's it.
I think I wanted to ask you too, lastly, thank you for sharing all those cool ideas, JaCarie. Um, Lastly, I wanted to ask about working with babies and doing tapping. Some people have talked a little bit about that. Can you share a little bit about doing the EMDR with babies?
Absolutely. Um, as some of you may or may not know, I worked 0 to 18, and the youngest I worked with was 15 months. And simply the way that it's done is when the baby is in distress, I may either have mom or have caregiver or have myself tap on baby's feet while we're saying positive things. So it may be like, it's okay that you're crying, you're safe now, mommy's here with you. The main thing is you want to be able to give baby a message, a positive message, right? So even when baby is younger, they still can develop, as you guys may know with the Erickson stages of development, they can still develop negative belief
Mhm.
systems. I can't trust that you can meet my needs.
Mhm.
Um, I can't exist. I'm alone. And so even with that language and just speaking to them, that's letting them know, one, they're not alone. Two, that you are there to meet their needs. You're attuned to them. And so that is some of the message that you want to give them. The way I would also do storytelling. So I also have dealt with like foster care and abruption of attachments. And so I will make the mom or the caregiver develop some sort of what we call a triangle of story. And it just talks about in child terms like, hey, mommy wasn't able to be here for you. Me being away makes make you feel like you are alone or that think that you're not safe. What I want you to know is that you are safe. I'm here now. Um, and just given that language. And so you are doing a therapeutic story with the baby as well.
Mm.
Um, the way that I kind of help parents be more attuned to kiddos is I do the thing called speaking for baby. So when baby is turned away, maybe looking like they're dissociating and whatnot, I may speak that to mom and say, "Oh, mom, I am I'm overstimulated, I'm over anxious," and then I encourage parents to then start to slow tap or maybe fast tap, depending on where we're at in this process, and just say, "I'm here with you,
Mhm.
mommy's got you, you're safe now."
Yeah, they can still take those messages in. Oh, well, thank
Mhm.
you. Thank you so much for sharing, JaCarie. Okay.